20% of patients hospitalized at home carry a totally implantable venous catheter, or TIVC. These central venous devices can deliver in the most effective and safest way continuous or intermittent long-duration treatment. Handling TIVC is a technical care at risk of infectious complications for patients who are most often fragile. At home, more than 9% of TIVC patients are potentially exposed to such a complication. The good prevention practices were the subject of a consensus statement in France in March 2012. At home, the realization of this treatment involves taking into account the architectural constraints and the organization of a living space, the interaction between the various home care professionals, the patient, and his relatives. Let's follow Aurélie, a nurse working in an at-home hospital organization, taking care of a patient in his own house with hospital's means.
Bonjour, comment allez-vous? Bien vous-même.
She's going this morning to treat a patient with a TIVC.
Bonjour monsieur.
Bonjour Aurélie.
Comment ça va ce matin?
Ça va tout doucement, un peu de douleur.
Un peu de douleur?
Ouais.
Vous avez pris les traitements qu'il faut?
Oui, j'ai pris du paracétamol.
Bon, ça s'est passé?
Oui.
D'accord. Est-ce que vous avez pris votre température un peu avant?
32.
D'accord. Vous avez eu le temps de vous doucher?
Oh oui, largement. Largement. Bon, on va pouvoir y aller.
Bon, je vais aller me laver les mains, on va commencer les soins. Je crois que vous avez tout préparé dans la salle de bain?
Oui.
Prerequisites for good hygiene are short or raised sleeves, bare forearms and hands without any jewelry, short nails without polish.
Ça s'est bien passé la dernière fois, il n'y a pas eu de soucis avec l'injection.
Aurélie is preparing her care. She cleans and disinfects the bed table, lays a drape on a clean surface.
Ce sera pour tout à l'heure. On va commencer par les masques. Un pour vous et un pour moi.
Merci, madame.
Vous savez le mettre? Alors.
Once the infusion reconstituted, Aurélie prepares the material that will be used for the insertion of the needle.
On dégage bien ça. Très bien. Et je vais enlever le patch d'amour.
It is important to verify the integrity of the skin and the absence of inflammation. Anesthetic cream residues must be completely removed before the cleansing of the skin. For needle insertion, the skin preparation must include a detersive cleaning phase with an antiseptic soap, followed by rinsing and drying. A disinfection step is then performed with an alcoholic product. If an alcoholic antiseptic is not available for home care, a major aqueous antiseptic can be used. The needle insertion is performed after spontaneous drying of the alcoholic antiseptic. The needle insertion requires sterile gloves. Safety needles also help to limit the risk of blood exposure during handling.
Alors, à partir de maintenant, il ne faudra plus bouger. Regardez de l'autre côté. Pas très agréable d'avoir le champ à côté.
Oh, l'habitude.
The choice of the so-called Huber needle should target a device suitable for the totally implantable venous catheter and the corpulence of the patient.
Attention, j'y vais.
It's strongly recommended to go completely and perpendicularly through the septum until the needle touches the bottom of the chamber without bending the tip. The needle cannot be kept for more than 8 days. Correct operation of the device is verified by the presence of venous reflux, followed by a pulsed flushing. Efficient flushing involves the pulsed injection of 10 milliliters of 0.9% sodium chloride through the use of successive impulses. Unlike pulsed flushing, rotary flushing has not shown interest to reduce the risk of complications. If a transparent, semi-permeable sterile dressing is used, it can be left in place for a maximum duration of 8 days. Otherwise, it should be replaced every 4 days. It will also be done again if it's dirty or unstuck. It's recommended to connect lipid emulsions to the proximal site as close as possible to the patient in order to facilitate rinsing of the infusion device. All manipulations should be performed aseptically and after hand disinfection using an alcohol-based product, and connection handling should be done with sterile gauzes impregnated with an alcoholic antiseptic. Now let's see how to dress for home care. Wearing an appropriate dressing contributes either for healthcare professional protection or patient safety. This dressing may change depending on the type of care performed. When inserting the needle and during dressing replacement, the operator must wear a gown or a disposable apron to protect its civilian clothes and a surgical mask and sterile gloves. The patient also wears a mask. Although sometimes provided in the marketed care sets, the cap use wasn't rated as a strong expert agreement in the guidelines. For proximal manipulation, that's to say at the needle and its extension, the professional should also protect its civilian outfit by a gown or an apron and wear a surgical mask. Wearing sterile gloves has been rated as a simple expert agreement in the final guidelines. For the withdrawal of the needle, civilian clothes will be protected by a plastic apron. Wearing gloves is required given the risk of blood exposure, but these gloves are not necessarily sterile. Wearing a surgical mask has been rated as a simple expert agreement in the guidelines. Now that the infusion is complete, orally is going to remove the needle. To prevent blood exposure, wearing gloves is required. The device is removed under positive pressure during pulsed rinsing. This pulsed flushing is also indicated after administration of any treatment, whatever the solute is, to avoid precipitation of incompatible products in the implantable venous access. Professional protection requires the wide distribution of safety devices and training in the use of these. In case of blood exposure, one must have a major antiseptic nearby for first aid and report the accident.
Pas d'inflammation, pas de saignement. Je vais mettre un petit pansement pour protéger. Voilà.
We've seen such care with the equipment available in the orally home hospitalization unit. Sandrine will handle some of the devices currently available in ambulatory care. Single-use care sets and safety needles should be preferred. The manipulations are simulated and done on a training implantable venous access covered with a fake skin. Let's see safety needles used to prevent the risk of blood exposure and avoid kickback. This needle secures during the withdrawal of the catheter needle. The positive pressure occurs in the same movement with safety needle with unimanual activation. Sometimes institutions provide nurses with equipment to remove the needles, such as pre-filled syringes. Other safety needles require bimanual activation and thus dexterity to perform withdrawal under positive pressure. One hand holds the base of the needle and performs a pulsed flushing, the other hand removes the safety needle. Huber needles and unsecured needles can be removed using tweezers or spatula, protecting the passive hand. All references are available on the French Working Group on the Risk of Blood Exposure, GRS, website. It is important to record the treatment to monitor the device and transmit information about the patient. Cares on totally implantable venous catheter are now common at patient homes. Recent guidelines have helped to clarify the attitudes and practices to better control the risk of infection associated with this device. The cooperation of the patient and family is essential. Performing this care at home safely is possible, and the level of care performance should be as close as possible to the same treatment performed in a hospital environment. The training of professionals and the choice of safety devices are quality pledges for the caregiver and the patient. The use of a patient surveillance notebook must be promoted in all care networks. More than ever, together, we are committed to safer care.